Perhaps the most exciting update that we heard in the era of immunotherapy for lymphoma at this meeting was an update of the Juno Transcend study, which involved their anti-CD19 CAR T-cell for the treatment of relapsed refractory aggressive B-cell non-Hodgkin lymphoma. They now have a median of 12-month follow-up, and so the objective response rates are similar to what we've seen previously, with a majority of patients responding and half of the patients going into a complete response. But with 12-month follow-up, we're able to see that the median overall survival has not yet been reached. And at 6 months, about 47% of patients remain in response. This is a group of patients who previously had no options for effective therapies, and their median overall survival was about 6 months. So this is really a remarkable improvement. What was also remarkable about the Transcend study is that it showed a fairly, despite the fact that CAR T-cell therapy has some unique and scary toxicities, it showed a fairly safe profile with a low incidence of grade 3 cytokine release syndrome and a low incidence of grade 3 neurotoxicity. And of course, it's very hard to compare across the studies of the other FDA-approved CAR T-cell agents, because the therapies, the different studies allowed for different bridging chemotherapy and had different eligibility criteria. But this is certainly intriguing and puts liso-cel or lisocabtagene maraleucel on the map to be competitive with the other two FDA-approved products for this indication. And the other exciting immunotherapy was really the early results of a phase 1 study of an antibody against CD47, which is a don't eat me signal that cancer cells exploit to avoid being phagocytosed by macrophages. And in a very early preliminary phase 1 study in combination with Rituxan in relapsed refractory diffuse large B-cell lymphoma and follicular lymphoma, this drug had an impressive response rate of about 50% and a CR rate of about a third of patients, with many of these responses being quite durable. And what was impressive was that the drug was very, very safe. There were very few grade 3 and grade 4 toxicities, and there were no immune-related toxicities. So this study is being expanded into a phase 2 study to see if they can replicate these impressive results in a larger group of people, which may add a new drug into the armamentarium for our patients.